好，罗嘎西木瓜拉，拉鲁木嘎达雅达卡西，大家好，我是小米穗基金会的董事关大伟，很荣幸今天可以在这里为大家介绍我们的讲者，就是 Amohia Boulton 博士。那 Amohia Boulton 博士是纽西兰Whakauae 毛利健康与发展研究中心的主任，那他也是这个奥克兰科技大学跟威灵顿维多利亚大学的兼任教授。那他的研究长期在关注毛利健康价值在社会政策服务输送中的一个实践的这样的一个议题。今天他要跟我们分享的主题是在 COVID-19 流行期间维护毛利人的健康、主权、关系与文化的重要性。在他的演讲里面将会分享毛利人在疫情下的行动跟策略以及这些行动跟策略跟这个殖民与复振运动的历史脉络之间毛利主权文化价值的展现。那我们的口译者刚才我们的董事长有提到，就是银之是中研院社会所的博士后的研究员。So our keynote speaker, Dr. Amohia Boulton, is the director of Whakauae Research Center for Maori Health and Development, with adjunct professorship at Auckland University of Technology and Victoria University of Wellington. Her work focused on Maori health and health service research, especially the interface between health and social policy and service level implementations. The topic of her talk today is ensuring Maori well-being during COVID-19, sovereignty, relationship, and the significance of culture. In this talk, Dr. Boulton will share some of this strategy and action highlighting value of sovereignty, relationship, and the significance of culture and how they connect to colonial history and Maori movement towards self-determination. Our interpreter, Anna Zhang Yingzhi, is the postdoctoral researcher in Academia Sinica. So now let's welcome Dr. Amohia Boulton. Amohia, please.
Oh, thank you. Ko te mea tūtahi he mihi mahana ki a koutou katoa, ko tauma nei I tēnei wā. He tino mihi ki a koutou, ko taimai, kia hau nei he tino pairau atu ki te mihi atu ki a koutou, ki te kōrero ki a koutou I tēnei kaupapa whakahirahira. Ko Amohia Boulton tōku ingoa huri a hau no Ngāti Rangi Nui, Ngāti Rangi, Ngāti Pukenga, nōku te honore ki te mihi atu ki a koutou. So in my language, I just wanted to greet you all and to acknowledge you all and acknowledge particularly the Indigenous peoples of your country and the shared struggles that we have. And hopefully with this presentation, we can have a good discussion about some of those issues. Thank you, Professor Daya.
刚刚 Amohia 先用毛利语做自我介绍，然后在自我介绍里面，他特别强调就是看见原住民族在台湾、在纽西兰一样的碰到的困难和我们现在集结在一起的能量，然后一起面对接下来的这些讨论。那刚刚这样子的毛利语的自我介绍，其实是会讲到他自己的山、他的河，然后他的家族。那这样子就是一个很完整的，然后也很典型的毛利人自我介绍和告诉我们他是谁的一个方式。OK。
So firstly, it is really a privilege to be speaking to you all today, and I wanted to thank the Millet Indigenous Cultural Foundation for the invitation to speak, and thanks to all those who have organised this presentation in the background. Yeah.
非常荣幸有机会在这里跟大家分享演讲。那要谢谢小米穗原住民文化基金会的邀请，然后也谢谢所有幕后的工作人员帮助这场演讲和论坛的顺利进行。
So, as has already been said by Professor Daya, I run the only tribally mandated and tribally owned research centre in New Zealand. And the presentation that I'm going to give today is drawn mainly from the experience that our centre and our tribe had during COVID-19 and during the lockdown that occurred.
那刚刚有如大伟老师的介绍，Amohia 是纽西兰唯一的毛利健康发展研究中心，唯一由部族所成立和管理的这样子的毛利中心的研究中心的主任。然后他今天要分享的主要就是从他们部族和他们的这个研究中心在过去1年里面发生的一些经验，他们采取的一些策略和针对防疫的行动。
So this is just a brief overview of what I hope to be talking about today. Hopefully I will stick to what I've said I'm going to talk about. So I will give a little bit of background about Whakauae Research Services, the place that I work. I'll talk a little bit about COVID-19 and our context and how that happened for us. And then hopefully the bulk of the talk will be about the Māori or the Indigenous response to COVID-19, particularly during the lockdown. And then my reflections of what I think some of the success factors were to that response.
好，那这是今天主要演讲的大纲。第一个部分就是他要先分享一下这个 Whakauae 研究中心的所在做进行的一些工作。那我这边译者的那个注意一下，就是 Whakauae 的位置是在 Wanganui， 然后我们可能台湾很多人知道纽西兰有一条具有人格的河，就是 Wanganui River。那 Whakauae 的地点就是在 Wanganui River 的河口，所以他们的iwi其实也有参加在就是那个人格化这条河里面的活动。那这是第一点。第二点，他会仔细的简单的讲一下，就是 COVID-19 在纽西兰过去1年的一些状态。那今天的主要的议题会聚焦在毛利的回应的部落的策略和行动，然后最后面提供一些分析想法，为什么这项过去这1年多的行动是成功的。OK。
So our research centre, as I said, is the only tribally owned and mandated research centre that undertakes health services research and health policy research in New Zealand. We sit outside the university, the tertiary system, so we are completely independent. When the centre was set up and it was established by Dr. Heather Gifford, there were 2 main reasons she set it up. The first was to develop the research capacity of the people of Ngāti Hauiti, the tribe that own us. And then secondly, to undertake research that is done in a Māori way for the benefit of the tribe and for Māori more generally.
好，简单介绍一下 Whakauae 研究中心的历史。那这个中心是刚刚说过，是纽西兰唯一一个由毛利部族所有和管理的毛利健康发展研究中心。它是成立于2005年，那个时候成立的创办者是Heather Gifford 博士。那他那个时候有主要的2个想法。第一个想法是要为 Ngāti Hauiti， 就是这个部族的名字 Ngāti Hauiti 这个部族成立一个研究的单位，然后另外一个就是要发展研究，然后这样的研究呢是毛利中心的，是为了部族的发展和为了毛利的整体族群的利益发展而成就的研究。Okay.
So I guess 2 things are really critically important for us. That with any research that we undertake, we are building the capacity of our own people, of Indigenous people, particularly of Ngāti Hauiti people, but of Māori people. And the research that we do comes from questions that are asked by our community that are important to our community. And those questions come to us in a variety of forms, but we need to be responsive to our community.
那这边很关键的概念就是，不管 Whakauae 做什么样的研究，这样的研究的最终目标都是要去成就、去扩充这个族群、这个部族跟毛利族群的能量，建立他们的能量。然后第二个部分是，所有的研究的问题其实都是来自于部落、来自社区的很急迫的需求。那这样子的需求就是可能是会有很多不同的形式，可是不管怎么样，作为一个部族所拥有和掌管的研究 中心，它基本上就是会往这样子的方向走，然后去回应部落的需求。
So very quickly, if you came to visit us, maybe in a post-COVID world, this is where you would come to. This is the heart of the tribe, and this is the entranceway to our traditional meeting place. Ngāti Hauiti are one of 4 tribes within the Mokai Pātia Nui Tonu Confederation. And those 4 tribes who are located in this area we call the Rangitike work together on a number of issues because they're very small. So they work together strategically to advance issues of importance to them. And all those tribes are descended from one ancestor.
好，那如果在后疫情时代，我们有机会去纽西兰的时候，我们去拜访他的时候，这个就会是他的部族的入口。那这个部族那Tihuiti是有一个联盟，这个联盟名字很长，我就不讲了，因为我肯定会念不好。4个这样子的部族成立了一个联盟，然后基本上就是在那个区域。那因为这些部族其实相对来说都是比较小的，所以他们就结盟，然后共同去思考在这个区域里面重要的议题。那这4个部族就是iwi，他们都是来自同一个祖先。Okay.
So I guess why I want to tell you this is because that connection that those 4 tribes have, that is based on genealogy back to one ancestor, is incredibly important for how and why tribes can respond in the way that they do to aspects like COVID-19. And I will talk about that a bit more. That idea that blood connection, what we call whakapapa, is one of the really, I guess, the key one of the key driving forces for the Māori response to COVID-19.
好，那这边会特别强调，就是这4个iwi他们是来自同一个祖先，他们是同一个祖先的后代，是因为要强调系谱，就是 whakapapa 毛利语就是 whakapapa 这个字，在毛利的世界里面，还有在这一次防疫疫情成功的关键性。那就是因为这样子，大家的血缘的关系很清楚的知道自己的关联性，所以在合作上面，在防疫上面是很成功的。
Okay, so now we're getting into a little bit of background about COVID-19 and how it happened in our country. And I needed to preface this conversation by saying that as Indigenous people, we have a long history and an oral tradition of our people being decimated by disease. So when we were first colonized, things like measles and smallpox and chickenpox wiped our people out. We had no immunity. And then later, the Spanish influenza in 1918 also decimated our communities.
好，那我接下来要先说一下，在过去新冠肺炎在纽西兰的过去1年的发展的状况。那在此之前，我要特别强调，毛利人对于流行传染病的经验是不陌生的，因为在殖民者来到之后，不管是水泡或者是西班牙的流行性感冒，各式各样的状况，其实在好多不同的历史阶段上面都带给毛利的部落很多的冲击。所以在这个上面，我们的毛利人的反应是很敏感的，然后很敏锐的。Okay.
So for us as Māori, because that history was so close, only 3 generations ago, so it was very real to us how the Spanish influenza had ripped through our communities. It meant that when COVID arrived on our shores, our leaders were very suspicious or didn't trust necessarily that the government would act quickly to protect and prevent COVID-19 entering our communities.
好，因为刚刚讲到西班牙的流行，我不太确定我用的中文翻译对不对，我有点想不起来。可是大概就是3个世代前的那个时候，就是1920-30年代那时候的大流行感冒，那个对于毛利人的老人家其实是记忆犹新的。所以当新冠肺炎开始出现，然后要进到纽西兰的时候，他们很快的、很敏感的就有察觉到这个会是对部落有危害的。那其实他们也不是这么对于政府会去做防范的措施是就这么有信心的，所以他们很快的就动作了起来。
You'll also be aware too that as Indigenous peoples, one of the things that we share in common is that we die earlier, we get diseases earlier, we suffer from those diseases more intensely, we access services less. And so in terms of healthcare and the protection of our health and well-being, again, leaders were very concerned about how the pandemic would affect Māori.
那在座各位可能特别知道，原住民族健康在整体上面的状况跟其他族群相较起来，不管是在平均余命上面，或者是服务的接受率的普及率，或者是在那个致死率上面，其实都有不太一样的差异。所以在这个上面，部落的领袖就很敏感，所以就觉得要赶快的有动作。
So this is a brief timeline about what happened. We know that this pandemic rolled out across the world incredibly fast. The situation for us was that on the 28th of February of last year, we had our first case in New Zealand. 2 weeks later, by 14th of March, our government had devised our levels framework. Before we moved into a lockdown, which happened on the 25th of March, our local leaders in our area, who are called Te Ranga Tupua, they had already begun to meet. So that is, I guess, evidence of their lack or lack of trust or mistrust, or that the government was not going to respond well for Māori, not respond as quickly as it needed to for Māori.
好，那这边简单回顾一下纽西兰COVID-19 进到纽西兰的状况。那第一个病例是在去年的2月28号进来。那3月14号的时候，纽西兰政府就已经树立了他们的防疫的机制，就是那个4层的像我们现在第3级的4层的这样子一个制度。那25号的时候，3月25号的时候，纽西兰就进入了第4级，就是最高级的，就是完全的封锁。那其实在3月17号，也就是在进入第4级之前，其实1个礼拜 Amohia 他们的部族的刚刚讲的4个族群的4个部族的联盟就已经聚会，他们领袖就已经聚会。那其实这样子就是反映出来，他们对于政府是会很快的行动去保护毛利人的健康这件事情是带有一定的质疑的，所以他们很快了就自己去进行了动作。OK。
So I talked about Te Ranga Tupua. So Te Ranga Tupua are a group of approximately 10 tribes. I talked about Mōkai Pātea Nui Tonu, who are 4. Then there's a wider grouping called Te Ranga Tupua, and that's 10 tribes. And it's the collective response of those 10 tribes that the rest of my presentation is going to be about.
不好意思，我刚刚没有讲错了。刚刚我说3月17号那个很快的部族领袖的反应是另外一个，不是刚刚那个4个族群的4个部族的联盟，是一个由10个部族所组成的一个联盟，然后他们很快就去反映这件事情。那接下来要讨论的毛利的防疫行动跟策略，是针对这10个部族的动作在进行讨论。
And while I'm talking about what's happening or what was happening in my local context with the 10 tribes I'm talking about here, also be aware that what was happening was replicated across New Zealand in various different local groupings, according to those genealogical connections, according to how tribes work together. There were some natural groupings of tribes, and they all worked in a similar way to meet the needs of their local communities.
等一下，后面Amohia要分享的是他所属的这个10个iwi的联盟的所做的经验。可是我们要记得，在他们的这个族群的位置是在北岛的西部的中部跟南部。那在纽西兰的北岛跟南岛其实还有很多区域，那这些区域的毛利的族人是会根据他们那边的系谱、他们的 Whakapapa、他们的血缘关系跟他们部族合作之间的关系，所以他们每个不同的区域都有自己的行动来确保他们的族人的健康跟平安。
And so, when I talk about these responses, I'm talking primarily around what happened during the level 4 lockdown. So to understand what level 4 meant for us, everyone had to stay in their homes. There was no travel. Travel was restricted. Only essential workers could leave their homes. All education facilities had to close. All businesses, unless they were essential businesses, had to close. All gatherings were cancelled. And so effectively, what we said here was you stayed in your bubble, and your bubble was whoever lived with you at that time of 25th of March in your house. And that's the only people you could see.
那这边先定义一下，先说明一下纽西兰第4级的意思。第4级的意思呢，就是完全的封锁，是不可以，是禁止任何的移动，除非你是必要的工作或者必要的企业，必要的商业活动。那所以学校是完全是关闭的。那在那样子3月25号宣布下来以后，就是每个人就处在自己的一个泡泡里面，就是你在那一天跟你生活在一起的人，基本上你就是留在那个地方，然后跟他们接下来的生活。Okay.
So then, given that, how did Māori respond? As I said earlier, for our leadership, the main thing that drove them was the protection of whakapapa, the protection of genealogy, the protection of our future as a people. So looking after those ones who exist, who live now, but also looking after those children who will come in the future, who aren't here yet. So that was what protecting our whakapapa meant.
那这边先讲，接下来我们就来看毛利的在防疫期间的一些行动。那最重要的观念就是毛利在做这些行动的时候，他们要保护他们的 Whakapapa、他们的系谱、他们的族群的延续。那不是只是现在活在这边的人，还有族群延续的这个命脉。所以这个是他们在防疫的行动和策略上面做的思考，要保护族群的延续。
The other huge driver for our leadership was a cultural practice for us that is called Manakitanga. And Manakitanga is hospitality or care or looking after or nurturing people. And if you are a tribal leader, your first port of call is looking after your own people. But Manakitanga means that you look after all the people who live in your area, whether they be indigenous or not indigenous.
另外一个很主要的观念就是 Manakitanga 这个概念。那这概念可能是做主人，或是关怀，或是照顾，有很多不同的翻译啦。可是基本上在防疫期间，部落的领袖们他们就是秉着这样子的观念，我必须要照顾我的族人。照顾族人之外，在我的这一块土地上面，其他不是毛利人，不是我的族人，我也需要照顾。作为一个主人，我需要提供这样子的一个想法跟这样子的服务。Okay.
So with those two important pillars, looking after whakapapa and then demonstrating Manakitanga, there were some really practical responses that our leadership had. And that some of those practical responses included the institution very quickly of a free phone number so that people could ring up and know that they would get a member of their wider community at the end of a phone.
好，那秉持着刚刚那2个观念，一个就是 Whakauae 就是延续族群的生命，还有另外一个就是作为主人照顾的这个概念，这2个价值下面有很多实际的行动。那当初第一个实际的行动就是马上设立了一个免费的电话，然后让广发出去，然后有需要的人他就可以拨起这个电话，那电话另外一头就会在他的族群里面会有另外一个是他的族群的人把他接起来，然后回应他的需求。
What our leadership did was, as a group, mobilize a workforce so that those phones were operated 24/7, and depending on the type of call, there were very practical things that people could give out. So people could give out food packs, packs to look after their babies and their young children, health packs. People could organize firewood for families that needed it.
好，那这些很实际上面的服务呢，支持呢，就包括在这个刚刚讲到这个免费电话是24小时1周7天都是在运作的。那部落的领袖很快就组织了一个工作团队，然后这工作团队就提供各式各样的服务。那这些服务包括提供食物的包裹，或者是针对小孩子婴幼儿的特别需求的包裹，针对宠物的包裹，然后有些那时候快要进入冬季了，所以提供木头可以生火，不然会很冷之类的，就是物质上面的协助。
The other thing that the 0800 number provided was a voice on the end of a phone for some of our most vulnerable in terms of our elderly. We were given 2 days to decide who was going to be in our bubble. And often there were elderly people who were left alone. And in a normal time, they would have their family who would come and visit them and bring them food and bring them bring themselves and spend time with their elders. But those people were quite isolated very quickly because of the bubbles. And the 0800 number was a way of keeping in contact with those elderly.
那刚刚讲到这个电话的另外一个很重要的功能，就是有很多部落的老人家，他们可能是独居。那在一般的状况下面，他是自己一个人住，可是常常会有他的家族的人、他的朋友会去拜访他，会去带食物给他，会有走动的机会，会有社交的机会。可是，在第4级的封锁下去之后，这些机会都没有了。所以这个电话也提供了很大的功能，就是跟这些可能是独居的老人家保持联系，确定他们有得到一定的关怀和支援。
This workforce that was mobilized was it ended up being called the Hub. So other services that the Hub provided, including a lot of people lost their jobs during the lockdown. So the Hub was able to advocate for people so that they could get a benefit to support their family if they'd lost their job. Yeah, maybe I'll stop there.
OK， 那所以这样子的一个工作团队后来就变成一个中心的一个概念，然后这个中心开始针对不同的需求提供不同的服务，像是后来就开始有些人就没有办法工作嘛，所以就失去工作了。那这个中心这个工作团队就去帮忙争取可能是补助啊，或是其他的机会，然后确定这些没有工作收入的人是有办法继续生活下去的。
The other thing that the Hub was able to do was to provide emergency housing. So at that time, we still had family who were trying to come home to New Zealand, mostly from Australia, and they might not have had anywhere to live while we were all in our bubbles. They couldn't enter those homes. So the Hub staff were active in finding emergency housing for those people.
另外一个这个工作团队做的事情就是提供紧急的 住宿。那其实毛利人有很多的人口我记得是40%还50%有在澳洲工作生活。那个时候就是疫情起来的时候，很多人回来，可是他们回来的时候那个泡泡已经被建立起来，他们是没有办法回到家里面的。所以那个时候这个中心也提供了很多紧急住宿的条件跟方式，去安置这些大部分是从澳洲回来的毛利人。
And another thing that the hubs did was ensure that they ran COVID testing stations, and they gave health advice to families to make sure that even in the face of a pandemic, that other things like your flu vaccination, that your well child checks, so your checks to make sure your baby is well, that those things all happen. So they provided health services for those communities.
然后这些中心在那时候还有另外一个功能，就是提供健康医疗的服务。那这个东西可能就是指的是新冠肺炎的测试，还有其他的健康，在疫情的条件下面没有办法达成的健康服务，比如说提供健康的资讯，可能生病了现在没有办法去医院，这方面的资讯的分散，还有在其他的疫苗，还有其他有可能是在没有办法去医院的状况下面需要接受到的医疗照顾，这个中心也提供了这些服务。
And then the final kind of really practical thing that I wanted to talk about is roadblocks. So a number of communities, including the Whanganui community, Māori erected roadblocks to prevent others coming into their community. In the Whanganui situation, that was possible because it was one road with a Māori community at the end of that road. That was the only community on that road. So those leaders knew that if anyone who wasn't from that community was coming in, then they shouldn't have been there. And there was a lot of controversy about the roadblocks, but our leaders were very staunch about why the need to maintain those.
那这边也特别讲到，台湾现在有在进行的就是检查哨的这件事情。那在他所在的地区 Whanganui 那边，就是的地理条件是这些毛利社区是刚好在路的就是最后面，所以这些领袖很快的就是决定我们要把这样子的检查哨设立起来。然后我们知道，如果不是这个地方的人就不应该要进去这条路。那当然这样子像台湾一样，就是造成了很多的纠纷跟很多的质疑。可是毛利的领袖是非常坚持他们这样子的做法的。
And then one other example I wanted to give, because this is still happening, has been happening beyond the level 4 lockdown. So between June and now, we've had a number of alert level changes where we've gone from alert level 1 up to 3 and back down again, mainly because we've had suspected cases in Auckland City, our largest city. There is a community in our area that is under a ski field, a popular ski field. That township has 800 homes. Of those homes, 76% are not occupied by the owner. They are rentals, and they are rented out to people that come for the skiing. So the leaders in that town, every time we change alert level, are very fearful of people that come from other towns to those houses in their town and what they might bring.
好，那到了今年1月开始，纽西兰基本上就离开了4级的这个状况，可是他们就是在1和3级之间就是浮动，就是在改变，在不同的时候有一些时间点上面的切换，然后几层级的防疫层级的改变。那那时候主要原因就是因为在奥克兰主要的城市，在他们的北边有一些可疑的案例出现。那在他们的这个区域有一个小镇是一个滑雪胜地。然后那个小镇大概有800个房子，可是有76%都是外面的人所拥有的，就是他滑雪的时候他才来的那种，就是度假屋的概念。所以在所有的 层级的改变，从1到2、3级这样的改变的时候，部落的领袖其实都很敏感，他们都会去注意到在这个地方特别可能有外人进出的地方，他们的移动的状况。
And finally, for this slide, I wanted to give an example again of mobilizing the workforce. So from our perspective as a tribally owned research centre, we immediately made 3 of our staff. We only have 9 staff, but at that time of the lockdown, we made 3 of our staff available to the tribe. So they, for that period between March and June, were doing tribal work on behalf of the iwi, because that's what we had to do. And that example was replicated in other iwi-owned organisations, tribally owned organisations, who were able to give up staff to help the iwi response.
我们这边再特别强调一下，就是这个时候工作团队的人员的动员的方式。那像 Amohia 就是他做主任的这个研究中心，他们有9个正职的人员。那在3月25号，就是开始这样子的状况，要动员这个工作团队的时候，他们就拨出了3位的正职人员进到这个部族联盟所要成立的这个防疫的工作团队里面。那从3月到6月，他们就是全部的这3位工作人员的能量就是提供在那个地方。那因为作为一个由部族所有和部族管理的单位，这是他们必须要做的。那其实这样子的状况是在其他的纽西兰毛利的各个单位上面都发生了这样子的状况，大家就是提供自己的工作人员。
So the other ways that our leadership kept us safe that were really important were that the strong advocacy and leadership that they showed at both a local government and a central government level. So the government set up emergency response organisations, but already our leaders had been responding in that way. And so those leaders made sure that they had seats at those decision-making tables, so that if a decision was being made at a local or central government level about Māori people, those Indigenous leaders would be there.
那再讲一下几个怎么样保护就是毛利社区的安全跟健康的方式。那在纽西兰发生疫情进来的时候，纽西兰的中央的单位其实就很快的成立了很多的委员会啊，还有组织要对防疫就是进行回应嘛。那其实这个时候我刚刚已经说到，就是毛利的领袖其实很早就有警觉会有这样的状况，所以他们在这些组织在成立在动员的时候，他们很快就加入了，所以他们很确定自己在那个谈判桌上面是有一个位置的，所以在任何时候毛利的需求和地方的需求是在中央是有直接的对口的。
And what we saw was actually the central government recognizing that they didn't have the ability often to get into the very needy Māori communities. And so they, during this time, actually gave up a fair degree of control and a lot of funding, and allowed leaders to use that funding and be very flexible with that funding to meet need. And what we saw was a lot of the contract arrangements, a lot of the really strict oversight and monitoring and reporting that occurred was left during that time, and iwi leaders were just able to use the resource as they saw fit.
好，那在那个时候发生的状况也是，其实中央政府，现在中央政府很快就意识到说，他们其实真的没有办法进驻需要资源或是有需求的毛利的社区的部落，所以在疫情的时候，他们开放了很多的条件，放宽，不管是他们在那个经费上面，或是他们在监督上面，就是他们的回报的督导，那叫什么？审查上面，台湾人最常见的审查这件事情上面，其实就是大量的放宽这些 本来是让人很痛苦的这些机制，因为他们就知道说我政府没有办法做，所以我一定要放手，让部落的领袖，让部落的组织自己去进行这样子的，给他们很有弹性的空间去发挥，去进行他们需要做的工作。
And then the final point that I wanted to talk about in terms of keeping the community safe was the idea that our leaders were able to balance what was coming from central government in terms of the best health advice. So central government were relying on what the World Health Organization was saying, what public health experts and what epidemiologists were saying about how to manage the spread of the disease in our communities. But at all times, our leaders were balancing that official health advice with how we maintained ourselves and kept ourselves well from a cultural context and what we required culturally to keep ourselves well.
这边在讲到第二个重点，为什么会第二个重点在毛利的对于疫情的回应的时候，有个重要的是，毛利领袖其实很有意识的知道说，官方会提供很多的资讯，关于防疫的公共卫生或传染病上面的来自世界卫生组织的资讯，然后这是官方给的资讯。可是同时，部落领袖也很知道说，要毛利人健康，我们需要维持毛利知识、毛利文化价值、世界观里面重要的这些核心的东西，所以在这两个知识里面达到一个平衡。
We, as Māori, we would say that we have cultural practices that have evolved over the millennia, over the generations, and have our own public health system about how we keep ourselves well. And that comes from our mātauranga Māori, from our Māori knowledge. So again, it's balancing the Indigenous knowledge with the Western knowledge to get what's best for our people. And the primary place, I guess, in which that you saw that balance that our leaders had to maintain was when it came to tangihanga, which are our funeral traditions.
那刚刚讲到这个，在西方知识跟在毛利传统知识达到平衡是一个很重要的事情。其实这个不是在防疫期间才有这样子的作为跟思维跟做法，其实这是长久以来毛利的运动一直提倡的观念，就是在西方的价值、西方知识跟在传统知识里面，我们两边都取得可以帮助毛利族群健康、好好生活、好好发展的这些价值。那在这个讨论里面，其实很重要的，我们可以看到的是丧礼的这件事情。
So traditionally, when someone passes away, all the people gather. We gather for 3 days. We sit around the deceased. We touch the deceased. We kiss the deceased. We mourn. We cry. All our fluids come out of our body, which is the worst thing for COVID. And so our leaders had to think about how we could do those mourning practices where we are expected to let our fluids flow with our deceased, how we demonstrated that and honored our deceased in that way, but within this new regime where we weren't allowed to gather and we had to be very hygienic and make sure that no bodily fluids were transmitted.
那这边就是举例丧礼的这件事情，因为在传统的毛利丧礼里面是有人过世了，有人离开了，大家会聚集在他身边3天这样子。那在3天里面，大家会亲吻这个人，会有很多的眼泪，然后会抚摸，会拥抱。那这其实在防疫期间是一个就是完全没有办法这样执行，是一个跟防疫的里面的概念还有它的策略是完全是冲突的。那现在我们就来听听看他是怎么样去协调，因为参加毛利的丧礼其实是很重要的一个部分，这样的社会知识是一个很重要的部分，可是要维持在当下防疫期间的需求。
And of course, as Indigenous peoples, part of that tradition is the importance of us gathering together as families, as sub-tribes, as tribes. All our whakapapa, all our genealogical connections brings us together around this deceased person, and how we honor their passing onto another place. So one of the things that our leaders did was we made great use of technology in terms of being able to gather on platforms such as this to mourn so that we didn't touch each other, and have our prayers go over the platforms like the internet instead of meeting face to face.
那所以刚刚讲到，在传统的毛利丧礼里面，体液的流动会是常见的。那因为疫情，所以要防范这样的事情。那毛利领袖们就想到，就是用科技的方式，让这些东西在线上的呈现。那这样子还是可以继续的去维持刚刚我们讲到 Whakapapa 这个系谱、这个族群延续的这个概念，我们要大家要集结在一起，对不对？我们现在在等大家集结在一起，然后我们也要把这个离开我们的人送到另外一个世界，就是继续延续这个系谱的这个概念里面，怎么样在疫情的状况的条件下面维持这样子的核心价值。
And to this day, even though we are now a year later, we are still practicing some of those traditional mourning practices for families of people who have been deceased, because this is the first time they've been actually able to have those bodies. They may have been kept in storage, they may have been cremated. Many of our families died over in Australia and are now being brought back, and so we are having again to adapt our tikanga, adapt our protocols so that we honor those people who passed many months ago, which is very unusual for us.
那现在要处理的另外一个状况是，有些人是在其他地方离开了，或是那时候在离开的时候没有办法进行这样子的丧礼的仪式的时候，他们现在在几个月之后，人过世几个月之后，他们也用其他的科技的方式来进行这样子的仪式。那其实这个对毛利的传统来说是有很不一样的一个改变，就是人离开了好几个月之后，我们才做这样的进行。可是因为在现代的情境下面，我们需要做一些调整，可是还是维持传统价值的核心。
Okay. So for me, there are at least 4 things that I think were the reasons our leaders were so successful, or our communities were so successful in managing COVID and in keeping it out of our communities, aside from the fact that obviously we had a very good government response, and that we are an island tucked away in the middle of the South Pacific. So that was, that helped us, but I do think there are 4 success factors.
那我现在最后要分享的是成功，纽西兰或毛利成功的一些因素。那基本上纽西兰作为在世界的边缘，就是在南半球，又是在比较离我们欧洲中心或是北美中心的这个概念是相对比较远的地方，那个病毒的流窜是比较是相对比较安全的。可是不管怎么样，他认为有4个主要的原因让毛利的纽西兰的防疫是成功的。
We had very strong and very quick leadership from our tribal leaders who front-footed the response on behalf of their communities, even really before the government could do anything out in the regions. The leaders had already done a risk assessment, understood the potential devastating impacts on their communities, and had come together and started to formulate plans really early.
那第一个原因就是毛利有很强而且非常快反应的领导能力。那在中央政府开始意识到，开始在就是做动作的之前，他们其实就已经在社区。在他们的区域里面，其实就已经去做过风险评估，他们知道可能会发生什么事情，然后会有造成什么样的影响，所以他们很快的就启动起来，去理解现实的状况，做盘点。所以在需要这些资讯的时候，他们很快就有了。那这是很强的领导。
Our leaders had a really deep knowledge and understanding of not only their people, but their community and how their community worked. They could access their people in a way that the central government could not. And they could mobilize those people around a kaupapa, around an issue in a way that the Crown couldn't, because we could draw on those whakapapa connections that need to look after each other, the need to be united as one people to care for our community.
那第二个成功的原因是因为，部落领袖对于自己的族群、自己的社区的知识是非常的深入，用非常深入的在地知识，他知道要怎么样让大家动员起来，然后知道用什么样的目的设定什么样的目标，让大家启动，然后有效的运作。那这个也是回到我们刚刚前面讲的，前面这两个第一个是 whakapapa 就是系谱维持族群的延续这样的概念，另外一个也是彼此之间的照顾。所以按照这两个毛利的核心价值，部落的人就很快的可以动员起来，然后去做这些行动。
Our leadership clung closely to those really important cultural values that have sustained us as Indigenous peoples over the generations. So they didn't take what the government said, you know, they didn't throw away, I guess, the important cultural values that we have, which are that we unite as one people, that we look after ourselves, that we drive our own responses. And while we couldn't do exactly all our protocols, we could adapt our protocols so that they work for us during this time.
好，第三个那个成功的原因就是非常强烈的去强调毛利的文化价值。那刚刚有讲到，就是在刚刚那个丧礼的仪式里面，我们有讲到，其实很多毛利的习惯是在防疫期间是会有一些冲突的。那可是毛利的领袖还是很坚持，我们要去维护我们这样子的核心，我们要连结，我们要彼此照顾，然后我们要自主的去做我们想要做的事情，自主的反应。那我没办法实际上照以前的习惯去执行这些文化价值、文化实践的时候，我们就转换它。可是同样的，我们达到维护我们的文化价值的这个目标。
And then the final success factor, I think, was the way our leaders communicated and the transparency that they demonstrated in that communication. So between themselves at the height of the lockdown, the leaders were meeting every second day to coordinate, and they were coordinating amongst themselves and then coordinating all the various people that sat under them and the work that they were doing. They used platforms like the internet to reach their people. They did specific videos to reach their people, and they were just available and showed as the community, as members of their community, we could see our leaders stepping up and see them taking that role.
第四个原因是很有效和透明的沟通。那刚刚讲到，就是这些领袖在第4集的时候，他们是每隔1天就会在线上有沟通的会议，有协调的会议。然后除了领袖之间、部族领袖之间平行的协调，他们还有对下面他们的工作团队的沟通。所以他们也透过其他的方法，像是拍摄影片、宣传一些想法、一些理念，然后让他们的族人就是很清楚的可以看到我们的领袖很快的就站起来，然后带领我们去做这些行动，针对防疫去做这些行动。
So that's really my presentation. And so I'm really interested if there are any questions or anything that I haven't explained well that people want to ask about now.
那 今天的分享的演讲大概就是到这边。然后他其实非常好奇大家有没有什么问题，或是有什么想法想要分享。大卫老师。
Thank you so much, Amohia. Thank you for the very knowledgeable and inspiring information that you shared to us. That make me further confirm that indigenous people around the world are somehow encountering similar challenge under certain circumstance. And the effort you've been doing in your communities and the success factors you share to us make me further believe that we should support each other, connect to each other. And your speech is definitely a very important step for building the connections. Thank you so much, Amohia. 所以我们现在就来开放来我们的线上的朋友们来提问或者是有什么心得来交流来分享。So let's open the floor to the questions. 线上的朋友们，我看到吴敏老师在线上，对不对？吴敏老师是不是可以有一些回应，或者是有什么样的问题要提出来
？Okay. Thank you for Daya giving me a chance to ask a question. So I'm Wu Ming from the National Donghua University Department of Indigenous Affairs and Development. And I have a question. I'm curiously, who are the member of the community who join the team to provide their service in the community? Are they trained in public health or in medical school? Do they have any those professional background to support your community? So this is my first question. Thank you.
Wu Min, can we have you to translate your question to Mandarin to our audience? And at the same time, Amohia will have some minute to think about it, about her answers. OK? 所以我们是不是请吴敏老师先翻译成，把刚才的问题先稍微用中文讲一下？
好，刚才我问那个 Amohia Professor 他的那个问题是说在他们在动员的这个过程中，那在这个社区层级的成员有哪一些？那他们的背景是不是有公共卫生或是这个专业的医疗背景？对，这个是我刚才问的这个问题。谢谢。
那很抱歉，我刚才也忘了跟各位线上的朋友说明一下其实各位你要提问不一定要像日老师这样自己翻译成中英文我们其实有银资在线上，所以您要用中文、英文来提问都可以那我们银资也可以帮忙来翻译我刚才只是担心银资可能那个时间点没有抓到，所以我就请日老师自行翻译。等一下可以请银资来帮我们的听众朋友提问来做翻译。我刚才看到有一位应该是薛颖曾女士有提问，我们等一下请她来提问。那我们现在先请 Amohia 来回答。Amohia, please.
Okay, if I understand the question properly, so there were a number of levels at which people responded. And it depended on the iwi organizations and who worked for them. So with us as researchers, we were able to apply our analytical skills to sifting through the enormous amounts of information that was coming from the government and translating that into language that our communities could best understand. So that was one job that the researchers or the academics or the we called them technical advisors could do. So that was one thing. I'll let translate that.
OK， 那老师的问题就是回应，就是在不同的部落， 和不同的区域会有不同的状况，而他就以他自己为例，作为一个研究者，他们的工作人员在这个防疫期间，他们能够做的就是用他们的分析能力，因为他们有很快的，他们可以大量收集资讯，然后去把重要的资讯截取出来，然后把对的资讯给出去。所以作为像他们的状况，就是利用他自己的能力在防疫期间提供自己的专业。那我想一般来说就是在防疫期间会有很多不同的需求吧，所以在不同的状况下面，这样因为刚刚讲的很多时候是有食物啊，或是这样子一线的输送这些东西，所以好，先讲这边。Amohia?
Yeah. So the second group of people, I guess, we have a number of Māori health providers, Māori-owned, Māori-governed health providers across the country. Many of their staff, nurses, community health workers, medically trained staff, were mobilised to do the COVID testing, to do other health promotion and health, like the influenza jabs. So they were mobilised to do all that work across the country.
那第二群的人的那时候的工作团队，当然就是毛利的。其实，在纽西兰有很多毛利的健康服务提供者，本来就有很多。然后在这个时候，这些单位当然也是很提供了他们的公卫医生或者是护士或者是其他公卫专业人员来提供照顾，不管是在其他流感疫苗或是小孩子的疫苗的施打上面，或者是COVID-19 的测验上面，还有其他的卫教啊，或是其他的医疗的服务上面，这个时候毛利的健康服务提供者，这时候他们提供了大量的工作人员。
Also down at the community level, we had just volunteers. So they might have been untrained people, just people from the community, retired people, or they could have been other staff who weren't needed on the front line, who would do all the going out and to the supermarkets and buying the food and putting the food packs together and putting the packs for the babies together and then delivering those back out into the community. So there was a huge voluntary staff as well that were coordinated by our different iwi leadership.
那第三组人就是其实是大量的志工，那这些志工很多是可能是退休的人员，可能是他的专业能力在当下没有明确的要使用他专业能力的人员，大量的志工，他们可能就是去超市购买，然后去包装那些刚刚看到的食物的包裹，或是给小孩子的包裹，给宠物的包裹，然后去运送这些包裹，然后就是提供很多其他的在疫情下面需要的服务。
And then the final group that I wanted to talk about was very early on. We have a small group of Māori public health experts, epidemiologists, statisticians who and clinically trained professionals who came together in a group called Te Rōpū Whakakaupapa Urutā, which was the Māori they came together as Māori with expertise in pandemic response, epidemiology, to provide some advice to government about what was required from a Māori context. That was something that Māori brought together, and so there was no compulsion upon the government to take their advice, but from a Māori perspective, they were incredibly important for us getting that conversation happening at a national government level.
然后第四个族群，第四个工作团队里面的人，其实要强调的是毛利的流行病学家，还有公共卫生的专家的医疗上面的专业者。那这些学者、这些研究者，他们其实很快的就聚集起来，因为他们必须要从毛利的角度去探讨这样子的防疫的疫情的状况。那其实这是没有有谁说很快要召集这样的东西，可是其实就是很自主性的，就很快的聚集起来，然后跟中央的政府其实就有很快的对话。那这是很重要的，因为在这样子变动的状况下面，毛利族群自己的专家可以在 中央政府里面有这样子的空间去探讨这些事情是很重要的。
Can I just say too, with regard to that group and those particular expertise that they had, how we have seen that play out. One of the really important ways that's played out is that because of the advice that they gave around inequities in Māori health, some DHBs have dropped the age limit for who gets a vaccine early. So some DHBs say that if you're 65, you should get the vaccine early, but some DHBs are saying we need to drop that to 55 because of the inequities in Māori health. So that's a really critical thing that they've managed to do.
好，那这边提到这一群人，第4个这群人就是这些流行病学专家、公卫的专家，他们在他们的工作里面，其实很重要的一个是争取到，因为要思考毛利的健康不平等这个平均余命的问题，所以他们在某一些这个决策是在地方，就是 DHB 就是区域的健康委员会的做决定，他们可以降低毛利人可以施打疫苗的顺序的年龄，所以跟台湾的状况是有点像，可他们是在区域的层级这样子做决定，所以因为健康不平等，所以降低毛利老人的这个年龄资格。
Okay, I'm over. That's one question. It's a good question. That's a good question.
Thank you, Amohia. Actually, we have some friends online. They post their question or comment. So now I will invite Anna Inzhi to read the questions online. And at the same time, we have Zhen Xueyin 老师 lecturer from Tzu University of Technology. So she would like to have some response to the talk. So after Zhen Xueyin 老师的response comments, we will have Inzhi to share the question, translate the question from Huang Zhanfeng. She is a social worker in the community. So after the comment, we will have Inzhi to translate the question from our social worker in the community, from Miss 黄展凤 ，OK， 所以我们先请那个曾老师哈来做一下回应好了哈。曾老师刚才有一些想法，对不对？我们请曾老师。
好，这样听得到声音吗？
可以再稍微大声一点。
这里听得到声音吗？因为
OK， 这样可以。
Okay, 好，谢谢你。首先非常高兴能够参加这个会议哈。在这过程当中，其实我对毛利人他们的印象应该是非常有自律的一个国家。虽然他们族群很少，但是就我对他们的认识，他们非常自律的。然后在这整个过程当中，其实我觉得，我相信我们都是被 COVID-19 已经变成是非常紧张的一个气氛围。那其实在这个过程当中，其实我非常赞同，尤其是在部落，我们能够感受到他们每一个人的辛苦。然后，但是我觉得我们还是要从人的本身去做自律自守。那过程当中，其实我也知道，在整个部落的过程当中，他们其实要防范，也在预防。过程当中，这个组织的人员其实几乎都没有我们这些医护相关的背景，他们在自我保护的那个防护的过程当中，其实有很多的漏洞跟出口。但是我们在这个过程当中，也是可以提供资讯的一个人员，因为毕竟我们就是部落的人。那其实在这个会议当中，我觉得我最大的一个想法就是，如果我们不单单认识这个 COVID-19， 但是我觉得我们应该要从本身开始执行，不管是组织还是本身，还是最主要从人开始去阻断的这个传播链。那其实在自主的过程当中，也要有发挥很好的一个自主权利，然后这样才能够在这个 COVID-19 的一个防疫的一个工作当中，我们才能够把它阻断掉，而不是说我们只是提供知识，但我们没办法在部落里面执行，这是我觉得比较憾事的一件事情。因为在这个过程当中，不管是在提供课程，或者是提供一些相关知识，但是部落的人好像没办法感同身受，因为他会觉得我们部落这个环境是这样大空间，其实要传播是非常的少，那个几率微乎其微，好像在这个世外桃源里面，不在这个世界里面，所以这是我觉得蛮憾事的一件事情。但是我希望 我们透过这样的一个会议，能够有更多的知识给其他部落人，在这个提供的过程当中，也能够发挥我们自己的能力去做。我觉得做会胜过我们说。然后我也很高兴听过这样的一个会议里面，能够知道我自己下个步骤应该怎么做会是更好的。然后这是我觉得最好的一个分享，这个会里面所学到的。谢谢。
好，非常谢谢雪英哦，谢谢曾老师。那我们是不是请
老师，你按到你的麦克风静音了。
OK， 对不起，谢谢雪英哈，谢谢曾老师。那我们是不是请银之很快的把这个回应哈，很快的简短的翻译给 Amohia， 然后再把刚才有一位瑞凤哈黄瑞凤小姐提出来的问题也一并的提出来给 Amohia， 好不好？好，谢谢。
That was a question and comment from Professor Zhen. She's a lecturer at Tzu Chi Technology College University, and she wants to share she wanted to say appreciation for listening to your talk and learning about how the hard work iwi and community and Maori put in to keep the community safe. From her perspective, I think she's been engaging with a lot of indigenous communities here now, and her experience is that it's difficult to translate some of the information, the public health information to communities, because we understand it as, the COVID-19 is contagious within 1.5 meters, but in communities the space is very vast, so we don't have that much distance to be worried about. So her worry is that that these ideas are not being communicated effectively, and she appreciates this opportunity to share, to see that being responsible for ourselves, for our people, for our communities is very important, and at the same time being aware of these ideas. She's appreciate this opportunity to be gathering together and using to talk about this. Mm-hmm. This is her comment. So sharing her experience working with communities these days. And then I have a question from a social worker who works in domestic violence. Mm-hmm. So her question is, if Taiwan goes into or under level 4 lockdown, nobody can leave the house, you're in your bubble, what are some actions or what are some strategies that you might deal with domestic violence? Because for vulnerable women, and we're not necessarily, it's not gender specific, but for people in a tight social setting, the pressure and the stress coming from level 4. So that's a question for you.
Okay. Just with regard to the first comment, and it might not be because it is written in English, but I've just put up on the slide a book that a group of Indigenous authors penned, and there is some writing in there about how we as Māori took quite complex and detailed information and then tailored it for our own communities, and there are some images in there and so on. So that might be a useful resource. With regard, should I stop and then come back to the domestic violence?
我先生，刚刚那个曾老师的刚提出来的分享啊，谢谢你。那这边 Amohia 提了一篇文，就是其实他是今天演讲的这个去年出版的这个研究报告，针对疫情的研究报告，其实里面有些分享一些怎么样去在部落的卫教去做个人防护的这个上面的一些经验的分享，是今天没有讲到，所以跟你分享这样子。
Okay. So now, interestingly, for New Zealand, it was Māori leaders who first flagged that if we are locked in bubbles, that domestic violence rates could skyrocket, particularly as people were getting laid off work and finances were getting stretched. So I am not aware. I have heard that actually our domestic violence rates didn't go, as high as we thought they would. I think the jury's out on that. However, I think we need actual research on that, because I don't know if there's a degree of underreporting. I am not sure what happened in that space, and I think we need more research to figure that out. here anyway. Yeah.
谢谢这个提问。那他说，其实在那时候有知道说4级封锁的时候，毛利的领袖其实很快的就会反映说，哦，家庭暴力这件事情可能会很快的会增加，因为不只是大家在一起，还有失业的状况、经济的压力，可能会造成就是家庭暴力的增加。可是事实上，过去这1年看来，毛利的状况是没有增加的，所以他认为 Amohia 认为说，这需要有研究去分析、去理解这个状况是什么，因为有没有可能是没有被爆出来，没有被通报出来，或者还是有其他的原因去理解这个现象？因为当初其实毛利的领袖其实也是担心会有这样子的状况。
What I can say is that, particularly for our research group, we have become really interested. So one of the other issues that we have is we have a housing crisis in this country, and Māori are often renting. They're not home owners, or they're living in and often renting very substandard, poor housing that's unhealthy, full of mold, wet, cold, damp. So the issue of healthy and safe homes being more than just something that is healthy in terms of warm, dry, and comfortable, but safe in terms of a place where violence doesn't happen, is so it's expanded our concept of what is a safe home and what do we require as a safe home should we go back into lockdown.
那这边就提到继续从他的研究者的角色研究单位的角色来说，那刚刚提到这个家庭暴力的事情，其实毛利的健康研究有很多之前是在做住家的研究，因为毛利的很多时候是租房子，然后租到的是比较不好的房子，所以他们有很多的气管，因为房子很潮湿，所以很多气管，尤其是小孩子很多气管的疾病。那所以之前对于安全的家庭的研究，其实很多是聚焦在这个上面。可是，在就是现在的这个状况下面，其实他们也会考虑说，在家庭里面安全，就是刚刚提出家庭暴力这件事情，安全的状况也是重要的。所以这个也是拓展了他们的研究方向，跟他们对于家的这个概念是不是安全的，是不是健康的拓展。对。
Okay, so because of the limitation of time, we are supposed to end at 3 p.m. So we probably have a few more minutes to take one more round of question. And after answering the question, Professor Amohia can also make a conclusion for the talk today. Okay, 所以我们现在有大概我看到线上还有一系列的问题，但是我大概可能把它等一下请银之把它简短浓缩成这个相关的几个问题，我看到的至少有2个刚好是一个英文一个中文的那个英文的部分是在问说那个设定那个checkpoint 的时候有没有 legal authority 的这个问题然后另外一个中文的是在讲说那个原住民事务部跟那个中央跟部落合作就是这是台湾原民会的角色类似像在问这样问题。那在毛利有毛利事务部，那毛利事务部在这中间的角色是什么我想这个也是蛮有意义的问题。然后高正治医师有提到说那个毛利也有很多基督徒嘛那所以那个教会的仪式既然是在那个基督教的教会，那毛利的文化价值是不是也有融合在那个里面这个是另外一个面向的问题。那所以我们是不是就请银之来把这个几个问题稍微翻译一下给Dr. Boulton 然后让他做一个回答之后，也为今天做一个总结好，来，那我们就请 Anna。
好，Amohia, so we have a bunch of questions, but we're going to talk about. I'm going to translate with you, combine it into 3 questions, and hope you can answer them. And we're coming up short on time. So the first question is about checkpoints. So were there conflicts between local authorities in terms of iwis or communities setting up local checkpoints?
Yes.
Were there conflicts, and how did that unfold, and how did that go about? And the second question is the role of Tipuni Kukuri. So the role of Tipuni Kukuri is Māori Affairs Department. We're asking this because we're thinking about the parallel of Indigenous Affairs Committee in Taiwan. So the role of Tipuni Kukuri during COVID and in the relationship between communication between the central government and local communities. And then the third question comes from a Taiwan doctor, Elder. His question is about Maori. There are many Maoris that are Christians. So to what extent are Maori values embedded into some of these church services that are funeral services that are held at churches, or how is the Christian value and the Maori values work together in terms of expressing Maori cultural practices?
Okay. So with checkpoints, yes, there was great, often, there was conflict. Interestingly, so if I think about the Northland example, many of the non-Māori who lived in Northland communities who were affected by roadblocks, because they're a very activist iwi, the people who lived in those communities who were non-Māori totally understood the need for the roadblocks and supported the iwi call for it. It was often visitors out of like Auckland who wanted to leave the city and go and stay in their holiday batch, because it was all just a big holiday for them. It was those people who often resisted the roadblocks and thought that Māori were, just should be all put in jail or whatever. So the way it was managed was often communication between those iwi leaders and police, and they negotiated and kind of cooled things down. And so that was some of the first ones. And then when the roadblocks became more and more, often the iwi leaders would get the police on side so that the police would be at the roadblocks as well. That's how it evolved further. But often it wasn't the communities, the non-Māori that lived in those communities. They didn't want people coming up into their community either. It was other people who did not live there full-time who were causing the issues.
我先翻译一下，刚刚的回应是对，是有冲突的。那其实他想说，纽西兰北岛最北边，奥克兰以北那边其实有很多的非毛利人住在那边。可是其实那些人其实对于设定这样子的检查哨是非常认同，他们认为需要做这样检查哨。可是其实有很多从奥克兰想要去那边度假的人，去那边玩的人，会对于这个东西是反抗的。那其实是有很多不同的发生的方法，可是通常毛利领袖就是会找警察来这边。然后我意识到我刚刚把问题翻错了，所以我再重新问一次，抱歉。Okay, I realized I had the question wrong. So the question was whether or not the checkpoints had authorization. Sorry, conflict.
Okay.
Sorry.
So early ones often did not. And that Northland example, there is a particular iwi leader who is just, he'll just go and do whatever he needs to be doing. And so often those early ones did not, but later on, subsequently, they did. They worked with the police closely.
Yeah. 所以这答案也是肯定的，所以就是是有透过授权的，就是警察的部门是有在支持，就是毛利的这样子的自主行动。
Okay. With regard to Te Puni Kōkiri, that's a really good question. In all of this, I've never heard anyone talk about Te Puni Kōkiri having a role. In the last couple of years, just generally, they've been really absent from a lot of policy discussions. I think, I don't know what that is. It's a really good question. But if I think about whānau ora, which you'll know, just as an example, just mainly for you, like they're not present at all. I don't know what they're doing, but anyway. So I don't actually know what their role was. It's like Māori stepped in the absence of a central government response around this particular kaupapa issue.
第二个关于纽西兰的毛利事务部和中央和部落的合作，那其实很奇怪的一个现象是，过去这几年好像毛利事务部在毛利健康这件事情上面是蛮缺席的，它的现身没有这么明显，尤其是在这次防疫的状况下面，其实都是各地的部族在地的单位直接跟中央的政府有联系。那不管说是在其他的毛利的健康计划，像是家族健康，是旗舰型的计划，其实毛利事务部的参与度是不高的。
My suspicion is that the Minister of Māori Affairs was not high enough ranked in cabinet. So the Ministry of Health were running everything, and the emergency powers meant that the Ministry of Health had considerable power. And yeah, just the Minister for Māori Affairs was not sufficiently senior to be leading anything out. And possibly that ministry was not, and Māori within the Ministry of Health were not, there was no voice, there was no space for them in central government. And so there was an absence, and that's where that Māori group of Te Rōpū Whakakaupapa Uri Tā kind of filled that hole. So
那没有提供他对于就是毛利事务部好像没有这么大的出现的这个一个原因一个想法是，就是在可能毛利事务部的部长在中央的层级不够高，尤其是在COVID-19 这个期间，紧急性让社会福利部、卫福部、让健康部、毛利的健康部不是纽西兰的健康部，就是很快的就是拿到主导权，所以毛利事务部的部长是没有发言，或是他的发言没有被听到的这样子的状况。那所以那刚刚我们有讲到那4群的工作人员，最后一个是就是毛利的这些公卫的专家、流行病学的专家，他们其实好像在某种程度上面是替代了毛利事务部跟中央做了这些对话。OK。
I'm very sorry for interrupting you, but we are running out of time. So, Amohia, would you like to answer the last question in very short time, like in 1 minute?
Yes.
Yeah, please.
I don't know how we do it, but we just do reconcile Christianity and our values. It happens just all the time. That's a very long discussion. So we just do.
最后一个开始的就是基督教跟毛利的价值，不是很确定我们怎么做，这是可以讲很多很多故事、很多的分享。可是基本上就是毛利人现在的做法，就是基督教价值跟毛利的传统价值是融合在一起进行的，很多活动。
好。非常感谢非常感谢Amohia今天很精彩的分享，也谢谢银枝非常到位的翻译还有在线上各位朋友提出的问题回应跟这个交流。那如同我刚才所说的，就是说Amohia的演讲其实是我们建立彼此支持的连结的很重要的一步那这一步一定是会再继续下去，所以各位未来如果还有继续的问题交流的一些想法，我们都会努力来促成，然后来大家形成更好的相互支持的网络。So thank you so much, Amohia, for your very inspiring talk. As I just mentioned that your talk is a very important step for building the network, for building the connection, for supporting each other. So we will continue the network, and we will have further exchange between our community. Once again, thank you so much. Thank you very much. Bye.
Can I say one thing?
Yes, please.
Sure, of course, please, please.
What we found out from COVID, this is my take-home line, is that Indigenous people know what's best for Indigenous people, and the more we have a voice at those decision-making tables, the better for us.
Great. 银枝可不可以帮大家翻译一下？
所以后面Amohia觉得要讲非常重要的一句话，就是新冠疫情的大家最重要的一个讯息就是。原住民族知道什么是对原住民族最好的事情，然后在那些决策的桌子上面，我们必须要坐在那个桌子上面，把这些决定，把我们的声音传递出去，然后我们就可以做好照顾好我们自己社区和族人的工作。
Thank you so much. Thank you, Amohia, and thank you all our participants today. Thank you, and thank you, Anna. Thank you.
Yes, thank you, Anna. Thank you very much.
Thank you so much.
Thank you.
Bye.
Bye.